aging and weight loss. It's kind of intriguing. We're always looking for magic bullets. As a physician, and I want to bring this up, how do you feel about people utilizing, these various now pharmaceuticals to kind of approach these problems, like Ozempic, drugs like anti-diabetic drugs to provide these rapid weight loss programs, or pre-diabetic or anti-diabetic drugs like metformin, which we know can interfere with the aging pathways in cells, but at the same time, you're dealing with pharmaceutical interventions, and people are losing sight of the fact that these profound, simple approaches with the nutrition you're talking about and physical activity and other lifestyle factors will get that job done without these ancillary risks. As a physician, it must disturb you to see these pharmaceutical approaches getting another heyday of popularity. How do you feel about that?
Yeah, to some degree, as you know, I'm left alone in the wilderness here as the only physician that objects to these things, probably, because people aren't given informed consent. You want to, they're not told and whether it's diabetic medications and telling them they're never going to be on these drugs the rest of their life, whether it's high blood pressure drugs, whether it's weight loss drugs. And both, by the way, most people who are overweight need to lose more than 20 pounds. These medications don't cause a lot of weight loss. They cause like 10 kilograms of weight loss over a year. That's 22 pounds. How's that going to help a person who's 75 pounds overweight? And by the way, it's only, what I'm saying right now is the direction of the travel of the weight plays a role, because when a person loses, let's say you lose 50 pounds, you gain 10 pounds back, you're higher risk of having a heart attack because you just put on 10 pounds before than if you lost. Then even though you're 40 pounds less than when you started, you're just moving the direction of gaining back weight. So all these people do is yo-yo their weight, push their weight down, and then their weight comes back. They bounce back with some rebound effects because the drugs don't work as much the second year. And it's not they're not permanent solutions. People, and just reinforce it. They don't have to learn how to eat right. And it's the same thing with gastric bypass to a degree, but in any case, I'm teaching people that a nutritarian is a person who's eating an excellent diet, who's at their ideal weight, or a person who's eating an excellent diet and moving towards their ideal weight every single week. And the minute you're not losing, or the minute you're gaining, then you're not on the program. Because if you're overweight and you're gaining weight, you're doing the wrong thing, and your health is not going to be good. Because your health is not good when you're in the process of gaining weight. And we're amazingly, while the person could be 30, 40, 50 pounds overweight, but they're still dropping weight steadily, we're keeping the inflammation down. We're keeping the HSCRP, the high sensitive C-reactive protein, the myeloperoxidase, the inflammatory markers, the insulin levels are lower, the estrogen levels are lower, the angiogenesis promoters are lower, so we're seeing benefits occurring when a person is still overweight if they're steadily losing and doing it the right way. But once you start yo-yoing, once you start regaining, once you start even taking drugs, you're not going to see the benefits hormonally, anti-inflammatory, and the anti-inflammatory benefits. You just don't see the carotenoid scores go up, and the levels of nutrients going up in their body, and the levels of inflammation going down, and the new hormones going back to normal. You're just not fixing the person. You're just giving them a crutch, another crutch, the same way medicine is practiced with everything else.
Let's shift into one of your proud babies that are in operation now. After everything you've done and all the energy you put out, and I know how difficult it is to run retreats and centers. Tell me about the Eat to Live retreat, and what was your motivation and your drive to put this residential center together?
It was about wanting, because I know that as you know, a lot of people can get benefits and do well from reading books and watching videos and studying and going to internet, involvement and have support. But some people, my feeling over the years was I had people I really cared about that just weren't able to control their behavior due to food addiction, and they've just, and ruined their health, even though they knew what they should do and they couldn't do it. So I knew that that going away to these health retreats for a week or two, where people eat healthy, go on sprouts, lose weight, and go back and they go off their diets and go back and gain the weight back. It does them no good. But I wanted to have a place where it could make it, where people could be on the right program for months at a time. We're talking here that I don't admit people if they come in less than 30 days. That's minimum, but I really recommend people come in 3 months. So most of the people are here at least 2 or 3 months, actually, the majority. And there, I really feel good about the fact that I can get them off their medications, and I can retrain not only their taste muscle, but also I can retrain them psychologically to see the world in a different way. and to know how to deal with the social interactions, the temptations there, since they're addictions, and get more gratitude feel more grateful for having learned this information and really understanding how this is the way they're going to be most happy. When they leave, it takes time to get people turned around. And so I really love the fact that I've turned around so many people, and even people who are here who didn't want to be here. Like a person who comes in because their parents forced them to be here and they weigh 350 pounds. And they're saying, there's no way they're going to eat like this. There's no way you're going to, by the time they're left in 3 months, they not only lost 100 pounds, but they stayed eating this way when they went home for the next year and dropped another 100 pounds. And they loved eating this way and became my helper here. And like the young person became at first, they were forced here like a prison. And in other words, it's very rewarding. And I wanted this different part of my life to not to work so hard, seeing patients all day long for hours and hours each day. But I wanted to be more with a lower number of people with a bigger connection with them, which I could still get my enjoyment of helping people and doing so in a way that has profound effects on the rest of their lives.
How much bed space do you have, Joe? How many people do you take at a time there?
Well, not many. We're only like 15 to 20 people.
That's very manageable, workable, and it's high quality when you do that. So in that program, you have a built-in opportunity for behavioral modification, stress management, that kind of thing as part of your staff people that do that too?
Yes, absolutely. And I even have, full-time exercise and water aerobics, but we're trying to mostly teach them exercises when they would go home. And I also have here, some people come in with pain and bad feet and bad knees. And we also have we have soft wave TRT. It's a type of electrocorporal shockwave therapy. And I look at people's pronated feet, and I do exercises with them in the sand on walking and strengthening their foot muscles. And we take pressure off the medial tibial condyle so they can walk more comfortably. So the time they get out of here, they can usually walk far distances and without pain. And I also have the extracorporal shockwave therapy. It's the type of equipment called soft wave TRT, that they get a series of treatments which can take away their frozen shoulder or their cartilage in their knee, or fix their Achilles tendonitis or something like that. So we have some other physical modalities that we utilize to help them be able to kind of help their pain and their physical musculoskeletal system at the same time.
Joel, as we wrap this up, do you have any final words, words of wisdom, insight, information you'd like to share with the people watching this?
Yes, I would just really am enthusiastic about all the people that are growing and spreading this good word to other people, because every person becomes like have the superpowers to radiate out goodwill for other people. And then you can't have goodwill for other people unless you're a good role model yourself, taking good care of your own health. And then you have the greatest reward to have creative goodwill for others while you're taking care of yourself at the same time. So don't give up. Strive towards getting your health in better condition, both physically, emotionally, and getting your weight at the exact perfect target where you're working on your musculature and your weight perfectly, because it's a fun hobby to be gardening, growing healthy food, organic, regenerative agriculture that you do yourself, and being physically involved with exercise and taking good care of your health and eating right all becomes fun and an exciting hobby that benefits you and others.